The Empathy Prescription. Revolutionizing Patient Care Through Emotional Intelligence Part 1. The Science of Empathy in Medicine Chapter 1. Understanding emotional intelligence in healthcare. Empathy in healthcare is more than just a soft skill, it's a clinical tool that directly influences patient outcomes. Studies have shown that empathetic interactions not only improve patient satisfaction but also reduce medical errors, foster trust, and even shorten recovery times. In this chapter, we'll explore what emotional intelligence means in the context of healthcare and why it's so critical for building meaningful patient-provider relationships. Emotional intelligence, refers to the ability to recognize, understand, and manage our own emotions and the emotions of others. It encompasses skills like active listening, nonverbal communication, and emotional regulation, all of which are essential for healthcare providers navigating the complex emotional landscapes of their patients. These skills are not only beneficial for patient care, but they also play a crucial role in the provider's well-being, helping to prevent burnout and improve job satisfaction. The role of emotional intelligence in healthcare. The healthcare environment can be a highly stressful and emotionally charged space. Patients come into hospitals and clinics often at their most vulnerable, facing uncertainty, fear, and discomfort. How healthcare providers respond to this emotional state can significantly impact the patient's experience and the outcomes of their care. Emotional intelligence equips providers with the tools to manage their own stress, maintain clear communication, and offer compassionate care. At its core, emotional intelligence involves self-awareness and empathy. Self-awareness allows healthcare providers to recognize their emotional triggers and regulate their responses. This is particularly important in high-stakes environments like emergency rooms or oncology wards, where a calm, composed demeanor can help soothe patient anxieties. Empathy, on the other hand, is about putting oneself in the patient's shoes, understanding their fears, frustrations, and hopes, and responding in a way that acknowledges their emotional reality. Research supports the critical role of EI in healthcare. A study published in JAMA found that patients of empathetic physicians were more likely to adhere to treatment plans and report higher satisfaction with their care. Additionally, the study found a correlation between empathy and better clinical outcomes, including reduced complications and faster recovery times. A case for empathy. The story of Sarah. Let me tell you a story about Sarah, a patient I encountered early in my career. Sarah was a middle-aged woman who had been living with chronic pain for several years. She had seen countless doctors, tried various medications, and undergone several procedures, but her pain persisted. By the time she came to me, she was frustrated, defeated, and emotionally exhausted. As I sat across from her during our first consultation, it would have been easy to simply review her file, prescribe another pain management regimen, and move on. But something about Sarah's demeanor stopped me. I sensed her weariness, not just from the pain but from the endless cycle of hope and disappointment she had been experiencing. Instead of diving into the technicalities of her condition, I decided to do something different. I listened. Sarah began to share her story, not just the physical symptoms but the emotional toll her condition had taken on her. She talked about how the pain had isolated her from friends, strained her marriage, and affected her ability to work. By the end of our conversation, I realized that what Sarah needed wasn't just another treatment plan, she needed someone to acknowledge her suffering. That day, we didn't solve Sarah's chronic pain, but we did lay the foundation for trust. She left my office feeling heard and validated, and I left with a deeper understanding of the importance of empathy in patient care. Over the next several months, we worked together on a holistic pain management approach that addressed not only her physical symptoms but her emotional well-being as well. By taking the time to connect with her on an emotional level, we were able to achieve better outcomes than she had experienced in years. The science behind empathy. What is it about empathy that has such a profound impact on patient care? Neuroscientific research offers some clues. When we experience empathy, specific neural circuits in the brain are activated, including the anterior insula and the anterior cingulate cortex. These areas are associated with processing emotions and understanding others' perspectives. Empathy triggers the release of oxytocin, a hormone that promotes feelings of trust and bonding. In the context of healthcare, this neurobiological response helps create a connection between provider and patient, fostering a therapeutic relationship that can enhance healing. Empathy also has tangible effects on patient physiology. Studies have shown that when patients feel supported and understood, their stress levels decrease. Lower stress levels lead to a reduction in cortisol, the body's primary stress hormone, which in turn improves immune function, reduces inflammation, and accelerates healing. Simply put, when patients feel cared for on an emotional level, their bodies respond more favorably to treatment. The challenges of maintaining empathy. While the benefits of empathy are clear, maintaining empathy in a healthcare setting can be challenging. Providers are often under immense pressure, dealing with heavy caseloads, time constraints, and the emotional burden of caring for seriously ill patients. It's not uncommon for healthcare workers to experience empathy fatigue or burnout, where the emotional demands of the job become overwhelming. This is where emotional intelligence becomes particularly important. By developing self-awareness, healthcare providers can recognize when they are reaching their emotional limits and take proactive steps to care for their own mental and emotional health. Mindfulness practices, peer support, and self-care strategies can all help providers recharge and maintain their ability to offer compassionate care without depleting themselves. Practical tips for cultivating emotional intelligence for healthcare providers looking to enhance their emotional intelligence. Here are a few practical tips. 1. Practice active listening. When speaking with patients, focus entirely on what they are saying. Avoid interruptions and make eye contact to show that you are fully present in the conversation. 2. Reflect on your emotions. After a challenging patient interaction, take a moment to reflect on how you felt and why. Understanding your own emotional responses can help you manage them more effectively in the future. 3. Engage in mindfulness. Incorporating mindfulness into your daily routine can help you stay centered and present, even in high-stress situations. This can improve both your emotional regulation and your ability to connect with patients. 4. Seek peer support. Don't hesitate to lean on colleagues for emotional support. Sharing experiences with peers can help alleviate some of the emotional burdens of the job and foster a sense of camaraderie. Conclusion. Empathy is a clinical tool in healthcare. Empathy is more than a nice-to-have trait. It's a clinical tool that can dramatically improve patient outcomes. By developing emotional intelligence and cultivating empathy, healthcare providers can create a more compassionate, effective, and human-centered system of care. As we move forward in a world increasingly dominated by technology, the human connection will remain at the heart of healing, and empathy will continue to be the bridge that connects providers to patients in their most vulnerable moments. Reflective questions. How do you currently show empathy to your patients? Have there been moments when you felt emotionally drained in your practice? What strategies can you implement to maintain empathy without burning out? How can you integrate mindfulness or active listening into your daily patient interactions? This chapter sets the foundation for the vital role of emotional intelligence in healthcare, focusing on the profound impact empathy has on both patient care and the well-being of healthcare providers. Chapter 2. The neuroscience of empathy and healing. Empathy is often seen as a soft skill, something we feel in our hearts rather than something we think with our brains. Yet, science tells a different story. Empathy is deeply rooted in the brain's wiring, and understanding its neuroscience can help healthcare providers harness it more effectively to improve patient outcomes. By digging into the science behind empathy, we gain insight into why it's such a powerful force in healing and how it can be consciously cultivated in clinical practice. The brain on empathy. Empathy is not an abstract concept, it is a tangible neurological response. Several areas of the brain are responsible for our ability to empathize, including the anterior insula, the anterior cingulate cortex, and the mirror neuron system. These regions collaborate to help us perceive and respond to the emotional and physical states of others. One of the key players in empathy is the mirror neuron system. Discovered in the 1990s by neuroscientists studying monkeys, mirror neurons fire not only when an individual performs an action but also when they observe someone else performing the same action. This mirroring phenomenon provides the biological basis for empathy. When we see a patient grimace in pain, our brain mirrors that experience, helping us understand their suffering on a visceral level. This system allows healthcare providers to intuitively grasp what a patient might be feeling and respond with compassion. Additionally, the anterior insula and anterior cingulate cortex are engaged when we experience empathy, particularly in response to others' emotions. These areas process the sensory and emotional aspects of pain, allowing healthcare professionals to recognize and share in their patients' emotional experiences. Through these mechanisms, empathy becomes more than just an emotional reaction. It becomes a tool for connection, understanding, and ultimately healing. Empathy's effect on the healing process. Empathy is not just beneficial for the patient-provider relationship. It also directly impacts the physical healing process. When patients feel understood, supported, and cared for on an emotional level, their bodies respond positively. Empathy reduces stress, which in turn lowers levels of cortisol, the body's primary stress hormone. High cortisol levels can suppress the immune system, increase blood pressure, and contribute to inflammation. By reducing stress through empathetic interactions, healthcare providers create an environment where the body can focus on healing rather than defense. Research also shows that patients who feel emotionally supported are more likely to adhere to treatment plans. A 2018 study published in the Journal of Patient Experience found that patients who perceived their doctors as empathetic were significantly more likely to follow medical advice, adhere to prescribed medications, and return for follow-up appointments. This increased adherence improves long-term outcomes and reduces the likelihood of complications or readmissions. The benefits extend beyond the physical. Empathetic care helps to address the emotional and psychological needs of patients, fostering a sense of safety and trust. This is particularly important for patients dealing with chronic conditions or life-threatening illnesses, where fear and uncertainty can exacerbate physical symptoms. Empathy can be the bridge that helps patients cope with the emotional weight of their diagnosis, creating a foundation for both emotional and physical resilience. Case study: Empathy in action. To illustrate the power of empathy in the healing process, consider the story of John, a 65-year-old man who came to the hospital with persistent chest pain. His condition was complicated by a history of diabetes and hypertension, and he was visibly anxious during his admission. While the initial medical examinations didn't reveal anything life-threatening, John's anxiety remained elevated, and his blood pressure continued to rise. One of the nurses, Maria, noticed John's unease. Rather than focusing solely on the technical aspects of his care, she decided to sit with him and ask about his fears. John revealed that his father had died of a heart attack at the same age, and he had been living in constant fear of the same fate. Maria listened attentively, validated his concerns, and reassured him that he was receiving comprehensive care. She also offered to arrange a meeting with a cardiologist who could explain his test results in more detail and address his long-term health management. The act of simply listening, of showing empathy, had a profound effect. John's anxiety levels dropped, and within hours, his blood pressure stabilized. While the medical interventions were undoubtedly crucial, it was the empathetic care that helped John emotionally process his fears, reducing the psychological stress that was aggravating his condition. Empathy as a clinical tool. Understanding the neuroscience behind empathy offers healthcare providers a unique opportunity to treat empathy not just as an emotional response but as a clinical tool that can be wielded deliberately. This doesn't mean that healthcare providers should force themselves to feel more empathy. Instead, they can learn to engage empathetic behaviors consciously, creating an environment of care that fosters healing. Several strategies can help healthcare providers cultivate empathy in their daily practice. 1. Active listening. As seen in John's case, taking the time to truly listen to patients without interrupting or rushing can have a profound impact. Active listening validates the patient's experience and helps healthcare providers gather information that may be critical to care. 2. Body language. Nonverbal cues like maintaining eye contact, nodding, and sitting at eye level can communicate empathy even when time is limited. These small gestures create a sense of connection and help patients feel seen and heard. 3. Mindfulness and presence. Practicing mindfulness allows healthcare providers to remain fully present in patient interactions, even during busy or stressful times. Being present signals to the patient that their care matters, which can strengthen the therapeutic relationship. 4. Self-care for providers. Empathy fatigue is real. Healthcare providers who constantly give of themselves emotionally may feel depleted over time. By practicing self-care, providers can recharge and maintain their capacity to offer empathetic care. This could include debriefing with colleagues after a challenging case or taking regular mental health breaks. The future of empathy in healthcare. As we move toward a future where technology plays an increasing role in medicine, the human connection will remain irreplaceable. Artificial intelligence and digital health tools may aid in diagnosis and treatment, but they cannot replicate the human touch that comes from empathetic care. In fact, the more healthcare becomes automated, the more critical empathy will be in differentiating a good provider from a great one. Empathy isn't just a moral imperative, it's a clinical necessity. By understanding the neuroscience of empathy, healthcare providers can consciously cultivate this skill, creating a healthcare system that not only treats illness but heals the whole person, body, mind, and soul. Reflective questions. 1. How do you currently incorporate empathy into your patient interactions? 2. Have you experienced moments where empathy improved a patient's outcome? 3. What strategies can you adopt to maintain empathy, even in high-pressure situations? This chapter serves to illustrate the profound neurological and physiological effects of empathy, offering healthcare providers both the science behind it and the practical tools to implement it effectively in their practice. By embracing empathy as a clinical tool, healthcare professionals can foster stronger patient connections and improve outcomes in measurable ways. Chapter 3. Measuring empathy, its impact on patient satisfaction. Empathy is often described as an intangible quality, something that's difficult to measure or quantify. However, in healthcare, it's becoming increasingly clear that empathy is not just a nice to have, but a fundamental element of high-quality care. When healthcare providers show empathy, the results are both measurable and profound. Patient satisfaction increases, adherence to treatment plans improves, and overall well-being is enhanced. In this chapter, we'll explore the ways empathy can be measured, the research supporting its impact, and how healthcare systems can use this knowledge to improve outcomes for patients. The importance of measuring empathy. Why should we measure empathy in healthcare? At first glance, it might seem difficult to quantify something as personal and emotional as empathy. However, measuring empathy is essential for understanding its role in patient care and ensuring that healthcare systems prioritize it as a core competency. Research has consistently shown that empathy correlates with better patient outcomes. According to a study published in the Journal of General Internal Medicine, physicians who scored higher on empathy assessments were more likely to have patients who adhered to their prescribed treatments. This makes sense. When patients feel heard and understood by their healthcare providers, they are more likely to trust their medical advice and follow through on treatment plans. Empathy also plays a significant role in patient satisfaction. In today's healthcare landscape, patient satisfaction is not only a marker of good care but also a factor that can influence reimbursement rates and the overall reputation of a healthcare institution. In a study conducted by the British Medical Journal, researchers found that physicians who exhibited higher levels of empathy had significantly better patient satisfaction scores. These findings highlight the need for healthcare organizations to not only focus on clinical competence but also to foster emotional intelligence and empathetic communication. Tools for measuring empathy in healthcare. Several tools have been developed to assess empathy in clinical settings. One of the most widely used instruments is the Jefferson Scale of Physician Empathy, JSPE. This tool was designed to evaluate a physician's ability to understand a patient's feelings, communicate that understanding, and act on it. The JSPE has been validated through numerous studies and is now used in medical schools and healthcare institutions around the world to assess and enhance empathy training. Another tool commonly used is the CARE measure, Consultation and Relational Empathy Measure, which allows patients to rate their healthcare provider's empathy during consultations. By directly asking patients about their experiences, the CARE measure offers insights into how empathy, or the lack thereof, affects the patient's perspective on the care they receive. Both of these tools have provided valuable data showing that empathy is strongly linked to patient satisfaction, trust, and even clinical outcomes. For example, a study using the JSPE found that patients whose physicians scored higher on empathy assessments had better control of their blood sugar levels, indicating that empathy may play a role in managing chronic conditions like diabetes. Empathy and patient adherence. One of the most important ways that empathy impacts patient care is through adherence to treatment plans. Empathy fosters a deeper connection between the healthcare provider and the patient, leading to greater trust. When patients trust their providers, they are more likely to believe that the prescribed treatments will work and are motivated to follow through. In a study published by Patient Education and Counseling, researchers found that patients who felt their healthcare providers listened to them and took their concerns seriously were more likely to adhere to medication regimens and follow lifestyle recommendations. The emotional connection created by empathy encourages patients to actively participate in their care, making them partners in the healing process rather than passive recipients of medical advice. Consider the case of Lily, a 45-year-old woman with hypertension. After being diagnosed, she was prescribed medication and advised to make significant lifestyle changes, including altering her diet and increasing her physical activity. Initially, she struggled to keep up with these changes and frequently skipped doses of her medication. During a follow-up appointment, her physician, Dr. Patel, noticed that Lily seemed discouraged. Instead of focusing solely on the technical aspects of her treatment, Dr. Patel took the time to ask Lily about her challenges. She listened empathetically as Lily expressed her frustration, not only with the side effects of the medication but also with her fear of failure. By acknowledging Lily's emotional barriers to adherence and working with her to find practical solutions, Dr. Patel was able to rebuild her patient's confidence. Lily's adherence to the treatment plan improved significantly after this conversation. This story highlights the direct impact empathy can have on patient adherence, and by extension, on long-term health outcomes. Empathy and patient satisfaction. Empathy not only improves adherence but also has a marked effect on overall patient satisfaction. Patient satisfaction is more than just a metric. It reflects how well patients feel cared for, respected, and valued. In many cases, what patients remember most about their healthcare experience is not the technical expertise of their provider but how that provider made them feel. A survey conducted by the Beryl Institute, a global community of practice dedicated to improving the patient experience, found that 83% of patients believe that how a provider communicates is just as important as the care itself. This means that even in situations where the clinical outcome may be uncertain or complex, showing empathy can significantly enhance the patient's overall satisfaction with their care. Empathy also reduces the likelihood of complaints and litigation. Patients who feel that their healthcare providers are empathetic are less likely to lodge complaints or pursue legal action, even in the case of medical errors. Empathy fosters trust and openness, which can mitigate negative emotions and encourage constructive dialogue, even when things don't go as planned. Practical steps to enhance empathy. Given the clear benefits of empathy in healthcare, how can providers consciously cultivate it in their practice? Here are a few practical steps. 1. Practice reflective listening. When interacting with patients, make a habit of reflecting back what they have said to ensure that you've understood their concerns. This simple act demonstrates that you're not just hearing but truly listening. 2. Acknowledge emotions. When patients express fear, frustration, or sadness, don't rush to offer solutions. Take a moment to acknowledge their emotions. Sometimes, simply saying, "I can see how that would be very difficult for you," can make a world of difference. 3. Incorporate empathy training. Healthcare institutions should prioritize empathy training in both initial education and continuing professional development. Role-playing exercises, workshops, and mindfulness training can all help healthcare providers develop and maintain empathy, even in high-stress environments. Conclusion. Empathy as a path to satisfaction. Measuring empathy is not just an academic exercise. It's a critical component of delivering patient-centered care. By assessing and improving empathy, healthcare providers can enhance patient satisfaction, increase adherence, and improve overall outcomes. Empathy bridges the gap between medical expertise and human connection, making healthcare a more holistic and healing experience for both patients and providers. Reflective questions. 1. How do you think empathy impacts your relationships with patients? 2. Can you recall a time when showing empathy improved patient satisfaction or adherence? 3. What steps can you take to ensure empathy is a priority in your daily practice? This chapter provides a research-backed exploration of empathy's measurable impact on patient satisfaction and adherence, emphasizing the need for healthcare providers to view empathy not as an optional skill but as a vital part of patient care. By prioritizing empathy, healthcare providers can transform the patient experience and improve outcomes across the board.